by Madison Goetzfridt for Fundamentals of Public Speaking with Russell Reel. Weakness, numbness, confusion of the brain, and blurred vision. These are all symptoms of a disease known as multiple sclerosis, a disease that affects thousands of Americans in the U.S. One of these thousands of Americans being my mom. Magnetic resonance imaging, better known as an MRI, can help detect many injuries, diseases, growths, and to help find the unknown that other machines cannot detect, like MS. The invention of the MRI has advanced the medical world in many ways. Today, I am going to inform you all on the amazing machine that detected my mother's MS at an early stage, the MRI. To create something amazing, it needs a foundation, something to build off of, to grow, and to evolve. And this is exactly how the MRI machine came about. According to the Tesla Memorial Society for New York, Nikola Tesla was the first person to set the foundation for the MRI machine. He discovered the rotating magnetic field in 1882. The strength of the magnetic field was then named after him. The strength is known as 1 Tesla or Augustus unit. The next step to the MRI was the NMR. This machine was invented by a man named Isidore I. Rabi. He recognized how the atomic nuclei showed their presence when they were absorbed or emitted by radio waves when exposed to a strong magnetic field. Then came to find the first NMR image by Paul Ludiger. Then came the birth of the MRI machine by Dr. Raymond Damadian in 1977. He found a major difference between normal and cancerous tissues when using an NMR, and thought it could be used to detect and diagnose cancer and other diseases. Once this thought came in his mind, he found a research team and dedicated his life to developing the MRI machine we use today. An MRI machine scanner is a large tube-like shape with a table in the middle so different parts of the body can be scanned. The scanner uses a magnetic field and radio waves to create images of the body's tissues and organs. MRI scanner is based off of 2 strong magnets. Our bodies contain numerous amounts of water molecules, hydrogen and oxygen atoms, and protons. These protons are extremely sensitive to any magnetic field and therefore acting as a natural magnet. When a patient enters the MRI machine, the first magnet causes the water molecules in our bodies to point one direction. The second magnet will then rapidly be turned off and on, and then will change the state of the hydrogen atoms and then rebound back to its original state. The magnetic field is due to electricity being transferred between gradient coils, which causes them to vibrate. This vibration will result in a loud knocking sound inside the MRI scanner. The scanner finds changes in a patient's body and transfers them to the computer where an image is produced for the radiologist to read. An MRI is mainly used to confirm and detect diseases and other injuries that other machines cannot. According to Medicine.net, some things that the machine can detect are injuries of the joints, diseases in certain organs, heart problems, abnormalities of the brain and spinal cord, cysts, tumors, pelvic pain in women, uterine abnormalities, and other deformities in different parts of the body. A neurosurgeon is one of the top doctors that uses MRIs to confirm and find different problems in the brain and spinal cord. MRIs give the doctors an inside look at the bleeding, the blood flow, the swelling, signs of strokes, and tumors. The creation of the machine has helped significantly to determine whether surgeries were needed and helped aid in the process during surgery to perform a precise procedure. There are many things one should expect before, during, and after the MRI scan. Patients may come from the hospital or walk-in prescribed by a doctor. According to Medical News Today, there is no prior preparation for an MRI. Patients will be dressed in a gown with no jewelry or anything with metal. The radiologist talks with the patient through the process of the MRI and may administer an intravenous fluid if needed. Patients may begin earplugs to diminish the loud sound of the machine, as well as blankets and pillows to comfort the patient during the scan. Some patients may also be administered a drug to help calm them down due to anxiety and claustrophobia. During the MRI scan, the body part that is being scanned will be fully submerged in the machine. The scan may take up to 2 hours. It is critical that the patient lay still during the whole scan to ensure precise imaging. The radiologist will talk through an intercom to the patient and walk through the process and answer any other questions the patient may have. Once the scan is done, the radiologist will check to see if the images are okay or if more need to be taken. They will then be sent to the doctors, and they will be read and then talked about with the patient. Like anything, there are advantages and disadvantages. According to NPS Medicine Weiss, a major disadvantage is that MRIs don't use radiation, so it is painless and harmless to the patient. MRIs can also detect problems deep within the tissue and cartilage around the body. During the scan, many images can be acquired in multiple planes that other machines cannot, which is another major advantage. A major disadvantage of the MRI is the cost. According to Time, a single MRI can cost up to $2,600. Another disadvantage, it is in a tightly enclosed space, which may cause individuals to experience anxiety or claustrophobia. Individuals with pacemakers or metal implants are oftentimes not allowed in the MRI machine due to the magnetic field. This can be a major disadvantage for individuals with these implants. All in all, the invention of the MRI machine has been a great addition in today's medical world. The machine has helped to detect many different injuries and diseases in various body parts. From 1977 to 2016, the machine has come a long way with many advantages over other machines. The MRI is a crucial machine in the medical world and will be in the future. Helping families find a solution to their loved one's medical problems can be hard, but with the help of the MRI, it can be done. Thank you.